Welcome to Successful Philanthropy. I'm your host, Jean Shafiroff. This show is designed to highlight the work of philanthropic leaders here in the United States and then beyond. With us today, Bobby Kalotee. He is the chairman of the Human Rights Commission for Nassau County. He's a philanthropist and real estate developer. Let's all welcome Bobby Kalotee. And Bobby, it's so nice to have you with us. And Bobby, my first question to you is, how did you get involved as a philanthropist at an early age? What were your beginnings like?
You're very kind, Jean. First of all, let me say thank you to you. You being a great host and philanthropist yourself and your family. I congratulate you. It's people like you who are role model for me, and many of them who I had followed and seen. And thank you having me today on your show in a small token. I will try to share with your audience to answer your question. I formally did not have any formal education. I start my life on the street of India, then through Greece and France, Italy. I end up in America 10 times, left 10 times. I left here by mistake. I had no intention to be here. But making long story short, I started as a dishwasher in the city in a very nice Greek diner, because that's the only language I spoke beside Hindi and Punjabi and Urdu, and I only spoke Greek. And I started as a dishwasher busboy, and God was very kind, given me the opportunity. That's why we call America the land of opportunity. And the blessing that I have from all people are going to call it, regardless of, even though a person in the diner who given me the chance, but it is America who given me the chance, and it humbled me to share and being very proud. And
this is all wonderful. Now, you're a real estate developer, correct? How did you go from washing dishes to becoming a real estate developer?
Okay, I think God has a plan for me, because he wanted me to serve the people, because I love people. Some people like drink, some people like cars, some people like something else. I love people. I literally love people, regardless of what they look like, where they come from, what their background is. I love people. Look at you, Jean, yourself. You care about the people. The reason you putting a message out in your show, because you care about the people in a many different way. To me, starting from a dishwasher to busboy and a waiter, then broke, couldn't pay my rent, didn't know what to do. A friend said to me, why don't you do something? You have a talent. I said, I'm going to start a construction company, but I have no clue what I'm talking about. I started it, and even though I did not know what is a skylight, that was my first job in the city of New York. And I did the job, and I succeeded. That was my first job, installing a skylight when I had no clue, but I survived. That gave me every day a chance to prove, not to somebody else, to myself, I can do better. I can learn if something I don't know. But on the end, I got a wife, got 5 children. God was so kind, so many friends. With all the things I don't like to say I achieved it. I should say I am blessed by the Lord and the society. So I felt, why not do similar things for someone else? Maybe somebody like me who all they need is a chance, or they maybe want to hear it. Maybe they want to know someone. Maybe they want to meet someone. And that's how I start from one thing to the others. And first construction company, then an environmental company. Then I wrote 2 books. I also published Yellow Pages. I had my own newspaper, national newspaper, in 1988 called Minority Business Time and Women and Business News. And at that time the president was a Clinton. It was my paper who put the editorial on the front page, and then Daily News copied me. And it was a big news. And my issue was, just like America had a bar bond, why can't they have a health bond? When Hillary Clinton tried to see what we can do health issue in America is the number one issue around the world, including then. So it's just a drive for the love of the people. I went one from the other. I end up then buying a real estate. I start my own microbrewery, and I even start a manufacturing coating, fire retardant coatings. But to me, each challenge is a gift to learn something, but in the same time, you also make money and helping someone else.
Yes. So this show is about philanthropy, and it's fascinating, Bobby, to hear about how you began as a dishwasher and then you became a big real estate developer. And obviously, you keep speaking about the importance of God in your life, your love of people, and your desire to give back. And you are the chairman of a charity called Friends of Good Health. And I want you to tell us a little bit about what that charity does and how we can get involved in supporting your efforts.
First, Jean, again, I want to say thank you for your kindness and the recognition. It is not my charity, it's our charity. Our charity to me is how I started it. Like I said, I lived on a street. I know what it's like when someone like you or your family who cared about me when I could not afford. And then one day I was traveling in El Salvador more than 13 years ago. I got very sick. Even though I could afford everything, I still didn't get that treatment. And I took a flight. I was able to come back to America, and I had my heart attack and I survived. By the way, for your knowledge, I have a triple bypass when I was only 39, and I have a 5 heart attack. One of them was only 3 weeks ago. So, but I still believe God wanted me to serve people. I truly believe that. So this happened in El Salvador. I say, oh my God, I could afford it. I couldn't get a help. What happened to these poor people who can't afford it? How are they going to get a help? Right on my return, I decided I'm going to have a charity to help people around the world. So we form a Friends for Good Health. It is all volunteer work. All my doctors are volunteers. Nobody gets paid for our services. We do not want any money from anyone. We do absolutely volunteer services. And thank you for your good suggestion today. I made sure in our website, we say that clearly. We do as a volunteer. I thank all my doctors. I thank all the staffs. Each time when we go, we see thousands of people for preventive care. It's much easier to treat people as a preventive care than the care becomes so expensive and cannot be treated. So that's what our goal is. So it started from the healthcare, but now we do a lot of other charitable situation. When there was an earthquake, when there was a flood, now it's a COVID. Now we are almost in 27 countries. We have our representative, somebody proud to say, I'm a part of Friends for Good Health. And everyone is a wonderful, fantastic. Nobody take the salary. They have the same vision, what I have, how we can serve our sister brothers without being difficult.
And now I have a couple of questions. So you have this charity and you don't collect money. So how do you send your doctors to different places to help the people? And where do the supplies come from?
Very good question. Thank you so much, Jean. Every doctor, when we set up a mission, like our latest mission was in El Salvador and Guatemala. So we took on that trip, I think around 50 doctors from here, and we take local doctor. We always share our program with the local doctors and the hospitals. And so we have almost 50 doctors from there, plus the young students from the local areas. Everybody's again volunteers. Doctors pay their own way to travel, their own way to stay. We might ask the hotel or another premises if they can discount, but everybody pay their own, including myself. Nobody get paid. And when come to the medicine, some people want to donate the medicine. We reach out to the manufacturer, sometimes to certain hospitals. So we request them to send it directly to the collaboration of whichever the hospital we're going to work in that country. So medicine goes directly there. Doctors are doing it without any cost. Nurses are doing it without any cost. Our dietitian goes. So when we go and eat, everybody pay their own. So it is the purpose of this is money corrupt people, money corrupt organization, money corrupt positions. So when there is no money involved, everybody is equal, everybody's belief is equal, everybody's to serve others are equal. So even though I have the title as a chairman, in my heart, they all are equally important.
So now your charity invokes volunteers. I read on your website, everyone involved, from what you're saying, is a volunteer and no one receives a salary. So this is quite an undertaking, but someone must be feeding in money, and that person might be you, to connect everybody and to make things happen. You
Yes,
must have
me.
mailings, and you obviously have some expenses.
Yeah, it is me. Most of our main office here, it is cost me personal money. There is some expenses which office rent we do. We have let's say couple of transportations, that insurance. When we delivering local, recently we deliver almost $3 million worth clothes. We just send 2 trailers to Miami, Dominican Republic, and there's going to be also Haiti, baseball equipments, a cloth, some other sports goods. Other people just donated it, but I paid from my own pocket to the trucking to go to Miami. Our sister agency, you can call it, or organization called Jack Brewer Foundation. Jack is a host, many times appear on Maria Bartiromo, and he's also former NFL players. They join in. From there, they're going to go and take a distribution. There's a lot of churches we are involved in it. Again, it's all volunteers. So credit goes to all those people. Like in India, we have one of the organizations we are collaboration with. They provide every day 3,700 meals twice a day to PGI hospital, no cost. People just donate it and goes directly to the hospital.
Well, this is really wonderful. And for our audience, we are with Bobby Kalotee. He is the chairman of the Human Rights Commissioner of Nassau County. He's a philanthropist and real estate developer, and he's discussing his philanthropic efforts through Friends of Good Health. Now, Bobby, speaking of India, India is in the throes of the pandemic, and they're in their very worst moment right now. I'm reading it's getting a little bit better, but already about 25 million people in India have come down with COVID. And I believe there have been about 250,000 deaths. And you coming from India, that being your motherland, are you involved in helping in India during this horrific pandemic? I think you started to explain that, yes, you were, but give us a little more detail, because it's a very terrible time. And to the people of India, I just want to say, from Successful Philanthropy, Jean Shafiroff, the host, my heart goes out to you. We want to help you in every way we can. Our prayers are with you. And now Bobby's going to talk a little bit about what he's doing for India.
Jean, first of all, again, I want to say thank you for your kind word. Thank you for your thoughts for fellow Indians and fellow human beings. It is around 26 million people, around 259,551 who are dead. It is still 27% down now from what it was before. And I'm glad it's getting down. I'm glad finally government getting their hands on. I had a big press conference. There's so many religious organizations that we are working with. We're sending everything that we can. from governmentally that I'm requesting or privately we are requesting, especially when it comes to the oxygen, PPE and others. We are trying through many organizations, and people are wholeheartedly trying to stand with India. Just like you said, your heart goes out. I think most good people do. And I want to say thank you to all good people, just like yourself, who are willing to think and serve fellow human being, regardless of where it is. Yes, it's a tragedy how and what happened in India due to they didn't care when middle of election in some states, in one of the biggest celebration, which was a religious place, and government should have been more aware of it. Again, nobody in the world knew how to deal with COVID, and we ourselves as American had gone through that. And Gene, I'm also the former chairman of the Nassau University Medical Center. As well, I'm still current trustee of the hospital. So I seen and I served there 14 hours a day in last whole years to serving my local residents, my local sister and brothers, because we end of the day, we all are one. We must care about each other. Together, we will overcome on this horrible disease, whatever you want to call it, and we will overcome together. Alone, no, we can't fight. And I thank all those people, including yourself, getting the message out. Please help everyone what you can. There is no medicine is a good medicine if the patient is dead. Time is now to help wherever is needed. If it's a Brazil, if it's America, if it's in India, if it's El Salvador, if in other countries, time is now.
Absolutely. And now getting back to India, are you sending doctors there? I understand from reading the New York Times that over 1,000 doctors based in India have died from COVID, from treating patients. And I'm just wondering if you're sending American doctors there now to treat the people.
We are trying to send, I'm also trustee of 2 local hospitals in India, by the way. And altogether, I think they have 5 hospitals, and try to work with them. I don't think there's a shortage of doctors are there. I think the shortage of medicine and shortage of oxygen and PPE is the shortage. Doctors are not the shortage. Nurses are not the shortage. My heart go out to those doctors and their families. And yes, they died taking care of their other sister brothers, but they wasn't prepared maybe as well as that we are now. There's a lot of doctors we know die here too. I know personally 3 of my friends, close doctor who died. I know personally 2 bishops, Bishop Gate and Bishop, oh geez, I blanked out the name now, and they had passed away. And 2 of my employees, I also own another financial company, and 2 of our employees died, 38-year-old and 42-year-old young men. This disease does not discriminate, but we should learn that lesson and to go against and fight whatever is taken.
Yes. Now, for our audience, we are with Bobby Kalotee. He is involved with a charity called Friends of Good Health and
Friends for Good Health.
Friends for Good Health. Now, Bobby, if someone wanted to write a check to your organization to help out, say they don't want to send supplies, but they'd like to write a check, maybe $5, $20, $50, $100, $1,000, $1 million, will you accept that money? And when I went on your website, I did not see a button to press if you wanted to donate, but will you accept that money?
No, we do not take money, but we be happy and honored to recommend that religious organization which is directly working so hard, especially the Sikh temples, Sikh gurdwaras, and they call BAPs. These 2-3 organizations working so hard, they provide everything free in their facilities in thousands. And so if somebody want to reach out to us, there is a cell number, there is a message place to you can leave the message. So we can direct you to the right people where it will be served directly. We do not like to recommend where there is a management. We do not believe because the money get wasted. When people's good heart to serve the people, money should not be wasted.
Very interesting, because I serve on 7 charity boards, some of which are international boards, others local. For example, Southampton Hospital Association, who, by the way, has done an extraordinary job treating COVID patients and keeping staff safe. But without funding, we would be in a lot of trouble. So most charities, of course, require funding. And I'm just amazed that you're able to do your work purely by having people donate their time and then donating actual goods and not accepting checks.
Yes.
I think it's a very unique way of having a charity. When I went on your website, I must confess that I was looking for your financial statements and I couldn't find any. And I said, well, how does a charity operate without any financial statements? And I guess you don't accept money, which is very unique. And I guess the person behind most of the work with your charity is you providing the money and you not asking others for the money, which is a wonderful thing. Now, you're also involved with another charity that gives out toys to children. Can you, Tots for, is it Tots for Toys?
No, Toy for Tots, US Marines.
Yes.
Along with US Marine, Major Chuckle Bride, who is the chair, I'm a co-chair, and a couple other people who are co-chair in the past. And we collect toys on behalf of all the good people to bring the smile to the people in Christmas time or different holidays. It's a greatest satisfaction. And we don't take any wrapped toy. It have to be unwrapped, have to be new. We do not take any toys. This year, actually, even through the COVID, and thanks to Major Chuck Kilbride and all the US Marines who was helpful, including the post office, including the police departments. There's many people who was helpful. Dean, I cannot tell you how proud I feel when I work on that charity. Growing up as a young child, I never had toys to play with because I was trying to learn how to survive. But when I see to deliver the toys to the families and see the kids smiling, it just makes my day. I feel like a child myself. I have my own 5 kids now. And I see, they're born here, they're able to have it. I know what it feels like when you don't have something to celebrate when others are.
And I'm with you on that. I think it's very important for every person to have an opportunity to celebrate holidays, and toy drives at holiday time are especially important for children and for their families. And I know I've participated in funding toy drives, especially in Hempstead, Long Island. And so I commend you on your work for the children by providing toys. Now, as Commissioner of Human Rights, as Chairman of the Commission for Human Rights of Nassau County, what are your responsibilities exactly? We have about 3 minutes left, and I want you to explain.
I will say
that.
this. Let me thank you for Jean again and your philanthropist thing you and your family do. I applaud you for it, okay? And please continue that work that you do. People like me, many of like me, had benefited, they will benefited. Please do not underestimate your work, and I thank you. Going back to the commission to answer your question, it's a privilege to serve another people. We have very nice commissioners on our board, and our responsibility is when there's a discrimination on their jobs, regardless of what they look like, when there's a discrimination on the housing, and that's where we get involved. And we are there to listen if there's an issue and listen it very carefully and work effectively immediately. That's my goal. Serve all and stop discriminating anyone, because end of the day, nothing going to go with us except our good deed were left behind make a difference in someone's life.
And that's very important work that you're doing. And I'm with you 100% that we don't want to have any discrimination regarding jobs, housing, human welfare, just about everything, and education. Now, Bobby, we have 1 minute left. And for those watching this show who want to get involved in the philanthropic process, I know what I recommend, but I'd like to hear from you, Bobby. You're a wonderful philanthropist, how you suggest to people how they might get involved.
Just remember, there's no greater satisfaction and happiness when you're able to share with someone else and enjoy the wealth. Dad used to say, there's nothing important if you are alone and lonely lying in a hospital. You want to enjoy, share with the world. Remember that it's your world. You can make it happiest world if you want to do it. It's up to you. So when all those people who can afford it, please remember the others who may be not as blessed, as lucky as you are. And if you can serve somebody, you'll be surprised how happy you will be after you making the difference. Yes, there will be some disappointment sometime, but that's life.
And that's wonderful advice. Now, Bobby, if people want to get involved in helping your charity, Friends for Good Health, how can they do that? What is the website? What is the phone number? We'd like to share that with the audience so that you will get some assistance from our viewers.
You're going to be very surprised. You said you saw something unique, right? I'm going to make something and more unique. Our website is friendsforgoodhealth.com. And my personal cell number, 516-351-3131. You know what? I don't sleep. I sleep 2-3 hours maybe. Sleeping is for dead people. Let's live and serve. That's the best thing to do. Don't hesitate to call me. I'm there to answer. If I don't answer, text me. God bless you.
This is all wonderful. And Bobby, it's been a pleasure to have you on this show. And I thank you from the bottom of my heart for all that you do for so many people. You are an amazing philanthropist. So thank you.
I want to end with it, thanking you and your organization and your staff, keeping the good work. Please continue. You'll be surprised the difference you make in people's life. God bless you and your organization.
Bobby, thank you very much for joining us. You are an amazing philanthropist. This concludes Successful Philanthropy. Our guest today, Bobby Kalotee. He is the chairman of the Human Rights Commission for Nassau County. He's a philanthropist and real estate developer. Thank you very much. I'm Jean Shafiroff, your host. I'll see you next week.